When I talk about the concept of bedside-to-bench translational research, what I mean ultimately is learning from every patient under our care, whether they're receiving standard of care treatments or treatments in the conduct of a clinical trial. The way that we will serve the next wave or the next generation of cancer patients the best is if we understand in the deepest way possible why it is that some patients are benefiting from the therapies that we're offering them in the context of clinical trials or routine clinical practice, and why other patients are not. When they share common features that we would think would make them equally likely to benefit. So understanding the determinants of response and resistance is how I think about the idea of increasingly applying precision approaches to our use of cancer therapy. And that allows us to do two things. Allows us to assign the next wave of patients to therapies that we have increasing confidence that they will benefit from because we have a better understanding of the determinants of response to treatment. And for the patients who have resistance to our available therapies, understanding those mechanisms and directing those patients to clinical trials that attempt new approaches to overcome resistance is a way we'll improve outcomes for those patients. So essentially, we need to iteratively continue to dissect the patient population in front of us using the molecular understanding, the molecular tools that we have to be able to direct the successful treatments to patients that we can identify in the future that have the same features as patients who've succeeded in the past, while we continue to double down and focus our effort in terms of developing new treatments for the patients that those current treatments are not effective for.